Hi guys, sorry for the long absence in my vlogs. It's been really busy and I have so much to tell you and so many different videos. So I'm going to start with telling you about what it was like on my most recent placement. I apologise in advance for any sirens, but I live right next to a hospital, so there we are. So my most recent placement was in the community, so it was very, very different to what else I'd done before. And I was with a nursing team covering children with complex needs. I also spent time going into people's homes and liaising with the services, going to a number of meetings, MDT meetings, and discussing these children in a broader context. I worked with hospices, I worked lots of different areas, and it was really, really good actually. It was less hands-on than I would have liked it to be, but again, learned a lot more behind the scenes sort of things, so it was really good. And I might work in the community one day, so really cool. I've also had some results back recently. I did an exam, I don't know if I mentioned it to you guys, for this module called The Sick Child Requiring Nursing Intervention, and it was we came to do 2 or 3 scenarios where we had to have a case study and be asked questions about it. So it might be about assessing for the particular problems, or how might you treat it with this fluid and so forth. So it's really knowing more about the treatment and management of certain situations. So it's quite difficult to get it all in there, but I managed to get a 2-1 in that, so that was alright. I also did an essay, something called evidence-based practice, and that was looking at the evidence for a skill and writing about and critiquing the study that was done using other frameworks, and I got 80, so that's the first, which is really nice. I'm trying to keep my grades up there because I really do want to get a first, but we'll have to see really how it all goes. So my next placement, I'm actually going back to Reading to do accident and emergency, so that'll be really different to what I've just been doing, and I'm really excited. This is a placement, it's my elective that I've organised myself. A lot of people go abroad for their electives. I would have loved to have gone somewhere, but it's the money and it's organising and it's insurance, and I do want to see what it's like in a district general hospital, which is very different to where I am at the moment. So yeah, it's all very exciting, and I will keep you posted about that as we go on. Finally, I want to say part of the reason I have been so rubbish at uploading is because I got into real financial difficulty last term. Cheers, NHS bursaries. And now I do work in a children's hospice as an HCA part-time, and so I've been taking shifts every week since January. I've had a week off now, so I'm really waiting to be booked again. It's really, really good, but it's quite tiring. It takes a lot of my time. It takes about an hour to get there in the morning or in the evening or whenever. So it's hard work, but I'm earning some money so that means I can stay at uni and I can finish my training. And yeah, that's the main thing, and it's been really good, and actually doing it has made me consider palliative care as an option one day as a qualified nurse, perhaps not straight away, because with everything I've realised that I do want to consolidate my acute experience and really get as much knowledge as I can before I move to specialise, and I think that's something I've come to realise, especially in these last few months. So guys, I hope you're doing really well with whatever you're doing. If it's applying or you're just starting out, if you've got any questions, please do ask me as always. I've had a couple of video requests from people, so I'm going to try and address them soon and make those for you guys, and please let me know if there's anything you want to hear from me. I will try and upload more often. I can't promise anything because, you know, my course comes first, my work comes before, just after that, so I can stay on my course, and but I do want to keep making these videos, and I hope they're helpful and give you a bit more of an insight into what it's like to be training as a children's nurse. So hopefully see you all soon, and as always, leave a comment, ask away, ask, and see you soon. Bye.